Santosh ma'am, please go ahead, ma'am.
Okay, fine. A very good evening to one and all present. On behalf of Department of Biomedical Engineering and Training and Placement Cell, AVIT Institute of Technology, Chennai, I welcome you all for the international webinar on nuclear medicine and its applications. In this regard, I would kindly request Dr. M. Ravindran, Professor and Head, the Department of Biomedical Engineering, to present the welcome address.
Thank you, ma'am. It's my privilege to welcome today's speaker, Dr. Ramasamy Rajesh Kumar. And it's a wonderful topic to start with the extracurricular activity for the department for this semester. And I welcome all the participants from various institutes and our own institute. And I welcome the faculty members who are actually in online for this international webinar. And I would also like to take this opportunity to thank our principal, our vice principals, and our management for encouraging us to carry out various events apart from our curricular activities, which always helps and enrich our students' knowledge on various aspects. And I hope this webinar would give us good insights on nuclear medicine, and it would be a good start on adding on new avenues. And I hope everyone would have a wonderful day ahead. Thank you, Santoshi ma'am. Please go ahead.
Okay, thank you, sir. Thank you. Now I request Ms. Lakshmi Shri to give a brief introduction about our today's session speaker, Dr. Ramasamy Rajesh Kumar.
Thank you, ma'am. It gives me immense pleasure in introducing our today's speaker, Dr. Ramasamy Rajesh Kumar. To start off with his education, he has completed his BSc Microbiology in the University of Madras in the year 2003, MSc Biotechnology from Bharathidasan University, Trichy 2005, PG Diploma Bioinformatics from SI Government of India in the year 2006, MPhil Biotechnology from Periyar University, Salem in the year 2007, PhD Environmental Biotechnology from Bharathidasan University, Trichy, and NERI CSIR Nagpur in the year 2012. And he has also completed MBA in Human Resource Management from Alagappa University, Karaikudi in the year 2015. He is currently pursuing his LLB General Law from Annamalai University, Chidambaram, and also PG Diploma in Data Science and Analytics from National Institute of Electronics and Information Technology. To talk about his postdoctorates, he has done his postdoc in Chonbuk University, Korea Republic in the year 2014, Nankai University, China Republic in the year 2018, Zhejiang University, China People Republic in the year 2019. To brief about his teaching experience, he has worked as an assistant professor in Department of Biotechnology from Lovely Professional University, Punjab. He has worked as associate professor and head in the Department of Biotechnology in St. Joseph's University, Nagaland. He has worked as assistant research professor in the College of Agriculture and Life Science, Chonbuk National University, South Korea, and also worked as a lecturer in Department of Bioinformatics from Jamal Mohammed College, Trichy, Tamil Nadu. As an entrepreneur, he has worked as an MD in GenPro Innovating Thoughts, Chennai, worked as MD in iPro Technologies, Trichy, worked as MD and senior scientist in Sync Biogenica Private Limited at Pondicherry, India. He has 25 notable publications in many of the important journals like Applied Catalyst B Environmental, Science and Total Environment, Electrochemica Acta, Poultry Science, Journal of Applied Biological Chemistry, Journal of Nanoparticle Research, Environmental Science and Pollution Research. He has presented 3 national conferences and 23 international conferences, and also given TV interviews in News 7 Tamil, Makkal TV, and Malai Murasu. He has also written a magazine article called as Vettukiligalai Kattupaduttum Technique in Pudhiya Thalamurai Tamil magazine. He has organized 50 plus conferences and webinars, and he has also received many awards for his recognition, like World Environment Day Hero 2019 from United Nations, Prize of Outstanding Contribution 2017 in Nangai University, China, Young Scientist Award from Deccan Environmental Research Organization, and also achieved Research Public Award in the year 2011 by Asian Journal of Experimental Biological Sciences, and many more. He has also professional membership in ISTE and fellow in the Society of Education India, fellow in Academy of Environmental and Sciences in India, and member of International Society for Applied Sciences, member of Asian Federation of Biotechnology, associate member in Bioinformatics Organization, moderator in International Forum of Microbes and Sustainability, and many more. Apart from all this, he has also done many responsibilities in the social work. Like he's the founder of Voice of Indian Concern for the Environment and Voice of International Community for the Environment. He's the founder and secretary of Art of Giving Charitability Trust in Tamil Nadu, India. He has organized COVID-19 relief materials for needy and poor in Manalur village, Tenkasi district, organized Gaja Cyclone Relief Free Medical Camp in Tamil Nadu in the year 2018. He has organized Old Age Destitutes and School Students Welfare Program in Tirunelveli district, organized 3 flood relief medical camps in Kadalur district, and acted as Bharathidasan University committee member during UGC and NAC committee visit in the year 2009. We are very much honored to have you as our today's speaker, sir. Now, I kindly request Dr. Ramasamy Rajesh Kumar to please take over the session, sir.
Thank you, ma'am. Thank you very much for the wonderful introduction about me. Am I audible to everyone?
Yes, sir, you're audible, sir.
All right, okay. So good afternoon. So all the participants, those who are sitting in front of your computer or watching this presentation through your phone. And today, actually, as you can see there is the nuclear medicine and its applications. So many of us know there are different kind of treatment methodologies available around the world. Okay, and so what the future is going to have, we are going to something beyond. We are having it right now because these days we are having a medicine which is common to everyone. For example, if I am having fever, so the paracetamol or any kind of medicine so will be given to everyone in this. I mean, the same. For example, maybe the quantity may be different, but the prescription of all the medicines are similar, same to everyone. So in future, what going to happen is so we are going to have drugs, actually the medicines. It's just specialized medicines, actually personalized medicine for all the individuals. For example, in future, what's going to happen, they are going to take all our DNA. Probably we are going to have a chip in our body. So with the chip, actually, they will find out what kind of so information about your body conditions. Everything will be noted down. Then after that, they will go for for the treatment. Especially, I could say, is a personalized treatment, personalized medicine. Okay. So the time we don't want to take consume much medicine now we are having. Okay. So the nuclear medicine is also one part of the future medicine, and today we are going to have going to have a few 40-50 slides about so nuclear medicine and its application. Probably mostly I want to discuss about what is nuclear medicine. All right, so as she introduced, actually, so I am the founder of Art of Giving Charitable Trust, and at Pondicherry I organized one international conference in the month of January. This year, and that time, the Chief Minister of Puducherry and former Chief Minister of Puducherry and Tamil Nadu Industrial Minister actually were present. And during this lockdown, I always hosted more than 20 speakers around the world about world's first coronavirus discussion series. So I initiated in the month of March actually. So that time, so some people actually pioneering. Actually, the time only many of them coming to know about the online programs, and also I initiated March. Then in the May month, I organized one international virtual conference on emerging infectious diseases with the support of Chaudhry Charan Singh University, Meerut, Uttar Pradesh, and also I organized various international faculty and research development program. Okay, so this is about the awards actually, as she has mentioned. Okay, so with it going in, okay, let me go directly to the presentation. Okay, so the disclaimer is like, all materials used in this presentation are from open sources. Okay, so none of the information which what I am sharing is not mine. So I hope many of us know, like, the Prophet Thiruvalluvar. Actually, this is one of the fine couplet actually came. So fine couplet from Thiruvalluvar, from the chapter called Medicine. Okay, that in Tamil it says like, நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பை செயல் நோய் இன்னதென்று ஆராய்ந்து நோயின் காரணம் ஆராய்ந்து அதை தணிக்கும் வழியும் ஆராய்ந்து உடலுக்கு பொருந்தும்படியாக செய்ய வேண்டும். The couplet actually, disease its cause, what may abate the ill, let leech examine these, then use his skill. Okay, the couplet explanation is like, let the physician inquiry into the nature of the disease and what and how it caused, okay, and its method to cure, and treat faithfully according to the based upon the medical rule, because there's a ethics for like any kind of like treatment. So based upon that rule, actually, like any kind of like disease should be like treated. So many of us like knows like, around the world die because of lots and lots of like various infection diseases. Okay, especially tuberculosis, malaria, and HIV. Okay, so and especially like in India, actually malaria was controlled, but if you compare with like African countries, when you go there, African countries, there are like, still like the people are like, suffering with malaria and tuberculosis, especially. In India, so we also having a tuberculosis problem, but so far like we have the DOTS medicine. 6 months we need to take the medicine, but the company where I was really associated, AstraZeneca Pharmaceutical, they are making trying to like come up with medicine which can like given short span of time, so get cured from the tuberculosis. So see, that's why like there are like many diseases like emerging every now and then. So especially we can notice now, so we are facing with the COVID-19, the coronavirus, so that made actually like lots of issues, and we can notice like so we totally like the whole world is not functioning, and we are like facing lots of issues. Okay, so especially the developing countries, we are having this kind of like issues, and it's going to be like very problematic. So what are the most 10 biggest killers around the world? Is first one is the acute lower respiratory infections such as pneumonia. Actually, again COVID-19. Okay, killed 4.4 million people, about 4 million of whom were children, young children. Just imagine, the 4 million are young children. And viral diseases including cholera, typhoid, dysentery spread chiefly by contaminated water, food, killed 3.1 million, and again like most of them are children. And TB killed 3.1 million, mostly adults. And malaria killed 2.1 million people, including 1 million children. And hepatitis B virus infections like killed more than 1.1 million people. And HIV more than 1 million people. And measles like again 1 million children. Neonatal tetanus killed almost like 460,000 infants. Whooping cough killed 355,000 children. And intestinal worm disease killed at least like 135,000 people. So we can witness this kind of like issues happening like every now and then, and most of these diseases are like very common. So we cannot say this is a kind of like an epidemic or like pandemic, except that the first one, the acute lower respiratory infection. We have like a SARS, then after that we had a MERS, and we got like SARS-2, the SARS coronavirus 2 actually. So the reason is like the respiratory infection is very dangerous. That's how like the people are like getting afraid that in future actually if there is any kind of like a bio what happens, the target will be the system. So even like you have known that the bacillus anthrax, what it does again, the bacillus anthrax is actually what it does again, it infects the lungs of our body. So the most important like the disease actually I could say is like acute lower respiratory infection. And these are common diseases: tuberculosis, intestinal worms, malaria, again hepatitis, and acute lower infections, and STD, sexually transmitted diseases. Okay, and the whooping cough, meningococcal meningitis. Okay, so these are like the most common like infections around the world. And these are some of the new diseases like so arrived actually since 1973, actually rotavirus, and then we got like Cryptosporidium parvum, a parasite which causes the diarrhea, and 1970 Legionella pneumophila, bacterium which causes fatal legionnaires. And 1977 we had Ebola, so it killed actually even Ebola actually the virus even in the African countries. So you would have a reason in past decades actually you would have came to know about the Ebola virus killed many of the African people. And 1977 Hantan virus, and 1970 Campylobacter jejuni, and 1980 human T lymphotrophic virus 1, and E. coli was 1982, and 1982 again HTLV2, which SARS-CoV-1, there were two different kind of virus actually that emerged and that causes leukemia, very dangerous disease. And 1983 the Helicobacter pylori, bacteria was a peptic ulcer, that is stomach cancer. And 1983 HIV, and 1988 hepatitis E virus, and 1988 human herpes virus 6, and 1989 hepatitis C virus, and 1991 guanidinovirus, and 1992 Vibrio cholerae, and 1994 Sabia virus, and 1995 human herpes virus 8. So that are some of the the disease actually which emerged since 1973. And now you can see here is so what we are having here is global health epidemic timeline. So what other things happened? In 2016 there was Zika virus which was noted in Brazil, and 2015 malaria in Uganda, and 2019 Guinea, that is Ebola outbreak again, okay. And in 2010 California, that is a whooping cough, and 2010 actually this was there is a cardiovascular disease actually, many of them infected with heart related kind of problems. And 2008 worldwide rotavirus issue happened, and 2004 this is so the angle of the Marburg virus, and 2000 worldwide obesity. So we can find the n number of things happens, and here you can see this is not the first time that we are having this pandemic. It was since 541 AD. So since then we are having lots of infections and killed many people in and around the world. And these are some of the pandemics since as I mentioned the plague was in the 168 to 180 AD. So since then, we are having lots of infections, and now we are having the COVID-19. Okay, this is the current data of coronavirus infection around the world, and so far that's 39,635,719 patients case has been recorded, and deaths 1,109 around 860 people has been dead actually, and record rate is 29,680 608,452 people has been recorded. This is the current data of Tamil Nadu. So we do have 675,000 total cases, and record cases 622, and this actually around 10,472. And in India actually more than 7.43 million total has been recorded, and the record rate is 6.52 million, and the death is 113,000 deaths actually has been recorded actually. This is data of current situation in India, and this is about the world actually. Okay, so why the diseases are spreading? So when we are going to know about diseases, before going to going for any kind of treatments, we should understand why there are diseases. Okay, the diseases happen because of the urbanization, because people start start living closely to each other because of urbanization, and also for job reasons they are moving from some small town to big cities. For example, if you go to Chennai or if you go to Mumbai, you can see Dharavi. You can see lots of slum, and also you can see in Tamil Nadu, which Chennai, you can see there's near Kuvam river. Actually, you can see lots of people. They will be living in the slum, living very close. So if any kind of infection happens, then suddenly it can spread from to the closest people living in a small area. And again, so it can be infection can happen because of wars, civil turmoil, or the natural disasters. Okay, through that also people used to get infection because of the time like might not be having proper kind of like transportation of like sending medicines, or there will be issues of proper like taking care of like the hospitals and all those things. So due to that, actually like the infection like spread very fast. And also again like the international air travel. So now we can see like all the flights has been canceled. The reason is the coronavirus can like travel from country to country through like those people like traveling in air. And again like the human habitation, and also sometimes like social changes, and some diseases are re-emerging. For example, the SARS coronavirus 2, that is like it's re-emerging, because like the earlier version was the SARS coronavirus 1, and next was like a MERS, and now we are having SARS coronavirus 2. So some diseases can like re-emerge, and when it re-emerges, then it's going to be very, very dangerous, and it's going to like kill many people. Okay. So infectious diseases actually like we can say there are like happens because of like viruses, bacteria, and also as we know parasites. So these are the like secret agents causing millions of cases of cancer according to the World Health Organization report. Okay. And also the stomach cancer, about like 550,000 new cases every year, like also are getting recorded. And cervical cancer, especially through sexually transmitting. Okay. And liver cancer, like another like big issue, like so for like 434,000 cases every year, actually, like getting recorded around the world. Okay, so now we are having infections. So how to like so we have seen actually what are the why the infections are happening, and what are the infections. So these are the information we got now, and we want to know actually, so when we get infection, like how it can be like treated. So how we can like get cured. Okay. So first step of like doing any kind of like treatment, before treatment, starting the treatment. Okay, so the first step is like we need to do the diagnosis, how the infection happened, and what is the cause of the infection, and who is the cause actually. Like so those information should be done, and which part is getting infected. So this information is very, very important before like start off any kind of treatment. So and the more important thing is like that the infection should be like found at the early stage of the disease, or it's like when you get more severe, and it is going to be very big problem to like treat the patient to recover from the disease, because the reason is sometimes our body won't be like able to work with the medicine, the drugs actually, because drugs are going to be very stronger when you're having like a serious illness. Okay. So that time when you're like giving any kind of like antibiotics, or any kind of like drugs that you're giving for a recovery of the disease, probably that time our body would have like lost control of the medicine, because the virus, viruses and this bacteria like multiply in very fastest way. So it's, we can't like imagine like how fast it can like go and infect. So it's very important to like find any kind of disease at the early stage. Okay, so there are like conventional methods, diagnostic methods are there, and for example, we can say very few actually, like, especially like countries like in Africa, actually, I could say countries in Africa, probably they don't have like so lots of like new technology or new methods to diagnose. Even for coronavirus, also like we don't have proper diagnosis. So what happened then? We just like we tried with the antigen antibody kit, and also we tried with the RT-PCR. But however, actually, so some conventional techniques is going to be like, very difficult, and also it's going to be difficult for the examination, for the clinician to like do the examination and like culture the organism. Okay, so these are some of the basic steps actually that can be done through the conventional method. But what happens when we're going for the conventional methods? Actually, it's going to take more time, and the test results won't be like exact. Probably it may be insensitive, and the results often like obtained too late. Okay, so we get the results very late to guide the clinical decision making. Okay, so what can be done? Actually, mostly the physician like won't able to give like a proper treatment for the infected person. Okay, so mostly the clinician usually use like laboratory tests. They start treatment based upon the laboratory test, a clinical and radiological test, and also like so that's going to help them to like diagnose, and also make the time of like patient to start with the treatment. So what are the laboratory tests actually mostly used to do the diagnosis process? Like, no, there is the first one is the erythrocyte sedimentation rate, and WPC and acute phase proteins and cytokines. But what happened? These tests are like not specific to discriminate between whether the person has an infection or inflammation. So that is going to be difficult for the clinician to differentiate. So that's why we need some new techniques, okay, to especially within the immunology, molecular biology, which is going to help us to find whether the person has an infection or inflammation. So okay, so let's see this. What are the imaging techniques? Okay, the imaging techniques can be classified as structural, and second is functional. Structural imaging procedure are evaluate macroscopic morphological changes, okay, and the implant loosening. Whereas the functional imaging has the visualize. Okay, so what they do, they visualize the specific accumulation of an infected injected gamma emitter radiated tracer, okay, at the site of infection. So from that, actually, there will be rays will be collected. There's a so I will show in my next slides. Okay, so how they are tracking down of specific, I mean where the place, which place the person has an infection. So it can be done through the imaging techniques. Okay, so what are the basic structural imaging methods? Are X-ray, US ultrasonography, CT scan, and MRI. And these are the based on important anatomic alternation and possibility of precautionary diagnosis very limited for this kind of methods. And but however, these methods are not going to help us to find where exactly the infection. Okay, it is where exactly the infection is. I mean, even in the early stage, this procedure only the morphological alternation. For example, if they do X-ray of lungs, probably they find out whether the person has an infection or not. That's it. But when you want to do so exactly how much percentage of infection is there, that is more important, because the stages of the disease is very important. When you go very late, actually it's not going to support us to start with the treatment. So these techniques are unsatisfactory in the early stages of disease. Okay, so there's a method actually to do the early stage disease diagnosis is called nuclear medicine. Okay, so nuclear medicine images are functional and can therefore identify the infection at the early stages. Also, it will also give the localization exactly where it is infected. Okay, so nuclear medicine is a highly multidisciplinary specialty, okay, that develops and uses pharmaceutical, that is radioactive isotope tracers, okay, to study the process and non-invasively diagnose, treat, and also identify the stage of the disease. And mostly the radiopharmaceuticals are molecular and having the cellular structures, okay, labeled with a specific radionuclide and are applied to patients after appropriate quality control. So it's nothing but actually so there will be radioactive isotope tracer, okay, that will be attached with somehow the chemical compound, okay. With that, actually, the radioactive tracer actually can be injected to the patient. From there, actually, we can get the gamma ray radiation when it comes out. So we can record and we can find exactly the stage of the disease, also exact location of the infection. The radiopharmaceutical is usually made up of two components. First one is basic substance for localization in a desired tissue or organ, and second one is tagging to basic substance to emit the gamma rays, and that can be detected and imaged with the gamma camera. Okay, the first one is we can find the localization, and second one is we can tag the substance, and we can we can get the results by getting the emission, the gamma ray emissions. Okay, the efficacy of the radiopharmaceuticals is therefore determined by these components. Okay, especially those above mentioned components, two components. Radiopharmaceutical localizes inflamed or infected tissue in the body, and what happened? The radiopharmaceutical emits the gamma rays, which can be detected, okay, when a patient placed under a gamma camera. So as I mentioned, it will be more easier when we are having the radioactive tracer. Actually, from there, actually the emission will be it can be recorded. And radionuclide emission based on nuclear medicine modality is a non-invasive technique, which is a quick, sensitive, and is a specific method to detect as well as locate the lesion at any anatomical site at early stage of the disease. That is more important. Actually. Like any disease should be like diagnosed at the early stage. That is going to like help us to save and can save life. Okay, let's know about like more something about like when the nuclear medicine was like first recognized. Actually, it was recognized in the year 1946 when it was tested by Sam Seidlin in the Journal of American Medical Association. So he's the first person actually like bringing this name actually like nuclear medicine. And Seidlin reported on the success of radioactive iodine, that is the I-131, in treating a patient with advanced thyroid cancer. The first two, the radioactive was I-131, and later the use of iodine-131 was like expanded to applications such as like thyroid gland imaging, hypothyroidism, and also quantification of like the thyroid function. So now actually we are having like many other like radioactive tracers, especially like this one like I-131. By the 1950s, the clinical use of nuclear medicine, like is like gone into like a very big way. So many researchers like shown interest to learn and understand and detect the radioactivity and using like radionuclide to monitor the biochemical process happen in our body. And several other research also like what tireless to establish the efficacy and safety and dying, because this is more important, because since we are using radioactive isotope traces and then we should like find out what is the quantity of the radioactive the traces should be like attached to the component. I mean any kind of chemical component. Okay, and also the safety is very important. So many of the times, like when we like lack actually the safety things, then it's going to be like very difficult for us to like cure the disease. And again, like the Benedict case of the first rectilinear like scanner and Hull Langer's scintillation camera helped establish nuclear medicine as fully developed medical imaging specialty. The Society of Nuclear Medicine was first formed in the year 1954 in Spokane, Washington, and in 1960 the society launched its first publication of a Journal of Nuclear Medicine, which became the flagship journal associated with the field. In 1971, the American Medical Association like acknowledged nuclear medicine as an official medical specialty. In the year 1972, the American Board of Nuclear Medicine was formed. Okay, so in nuclear medicine, like so how the things are like functioning. So let's see about it. In radionuclides are combined with the other chemical compounds to form the radiopharmaceuticals. Okay, so there's nothing but any kind of like chemical. For example, that chemical compound can be any kind of antibiotic. Okay, so the antibiotic will be attached to attached with a radionucleotide. There's radioactive isotope tracer. So the combined together to that the combined together the substance called radiopharmaceuticals. When administered to the patient, okay, what happens? The radiopharmaceutical target specific organs or cellular receptors and bind them selectively. So it goes to the specific place where it should be like attached. From there, actually, we can like find out like, what is the stage of the disease, and there will be external detectors, okay, which are used to capture the radiation coming out from our. I mean, like when you get injected actually into our body. And when we like do the imaging from there, actually we get radiation will be coming from the patient, and the radiopharmaceutical acid is like moves through the body, and it is that's used to generate an image. And mostly the diagnosis is based on the way the body is known to handle substances in health state and also disease state, because most of the time actually we don't know the we don't like consider the patient's age. Sometimes what happens actually, even like for small children, sometimes we give like the parents just like that should not be done in that way. So every age group has like different body metabolism. So based upon that body metabolism, or the like physics, the drug should be like administered, or else like it's going to create like side effects to the patients. Similarly for like nuclear, I mean, like nuclear medicine also. So it's more important to know the patient's health state as well as the state of the disease. Okay, yeah. So the radionuclide is usually bound to a specific complex, as I mentioned. Okay, so that's called radioactive isotope tracer that is known to act in a particular way in the body. When disease is present, the tracer may be distributed. Okay, and processed in a different way to when no disease is present. Okay, so so for example, if the person has a disease, then it will be go on like distribute into the exact place where the infection it is. Okay, if not, then it won't like show any kind of I mean, it won't like do anything. So we can easily identify the person has infection or not. So here is a simple explanation of how traditional methods and molecular imaging is functioning. So whereas the method, what we do, we usually collect the sample and we culture it. Okay, so this is how so we do it. We take the biopsy, we culture it, and then we find it takes it's a time consuming, and also it's going to be very expensive. Whereas the molecular imaging is very easy. When you give any kind of chemical compound along with the radioactive isotope tracer, what happens? It goes inside it goes exact place where the infection is present. From there, actually, it will give signal. The signal means it will be sending the rays. Okay? And if there's no infection, okay, so then there won't be any signal. Okay, so from that we can differentiate whether the person is infection or not, whether the person has the inflammation or not. So this is how the molecular imaging is different than the traditional methods. So here is another the example of how they are tagging. I mentioned, right? So the radioactive isotope should be tagged in any kind of material. Okay, for example, here you can see it's a chemical compound, and it was tagged with a radioactive tracer. Okay, so when it goes and attaches to the cell, and it goes various places, and from there actually so we can find out what is the quantity of the bacteria. I mean how much quantity of the bacteria is present. For example, after scanning, so we can find so how much that colony forming unit so minus 10 to the power 5 to 10 to the power 8. So this is how we can calculate how much quantity. I mean how at what stage of the patient is and what is the stage of the disease. So all those things we can find out using the tagged radioactive isotope tracers. Okay, so what are the advantages of what are the advantages of nuclear medicine technique? Okay, so nuclear medicine has an important role adding the diagnosis of particularly seated infections such as abscess, osteomyelitis, septic arthritis, endocarditis, and infection of prosthetic devices. It provides information on pathophysiological and again another thing most important is pathobiochemical process, because physiological we can easily do, but what happens biochemically inside our body is more important. Okay, so but this is one of the main advantage of nuclear medicine technique. Okay, in this respect, it differs from the other current imaging procedures such as X-ray, CT, MRI, and which supply information with high resolution on morphologic changes that occur in specific disease. So there is another advantage of the nuclear medicine. In addition, nuclear medicine permits the whole body imaging, whereas CT and MRI routinely focus on just only particular part of the body. But here in this nuclear medicine, we can do the whole body imaging. And nuclear medical imaging has an important role in discriminating from inflammation to infections. Okay, because many of the times we don't know what kind of the patient problem is. Many of them we just give based upon by making questions. Okay, so how do you feel, what happened through that kind of infection? The patient is to get the treatment from the physician or the clinician. Whereas here in the nuclear medicine, what happens? So we can exactly find out what kind of problem he has, whether he has an infection or has an inflammation. And inflammatory process can be visualized in the early phases when the anatomical changes are not yet apparent. Even it's when it's not showing up, actually we can easily identify early phase of any kind of diseases. Okay, the early detection of the infectious focus by radionuclide imaging helps both patient as well as the physician to reduce the cost as well as length of the hospitalization. So it will save patient money, as well as it is going to help the patient to know exactly what happened with the patient. Okay, so let's see what are the current radionuclides for infection imaging. The radionuclide is a substance which continuously emits radiation. Okay, so Generally, actually, we use 3 different kinds of rays. That is alpha, beta, and gamma rays. Okay, the radio forms can be labeled with actually labeled radio labels such as like GA67, MMTC 99, IN 111, and F18, 131IA, etc. Okay, so there are like many actually. Among these actually, this one actually technetium 99. Okay, so this is the most widely used radio nuclide. Okay, because it has a very good property of like emitting gamma ray that is like 140 keV, and its half-life like just 6 hours. So when it was like given to the patient, so after 6 hours, so it will be thoroughly like removed from the body. So and availability of 99 generation system is very actually the cost price is also like is very cheap when compared to other radionuclides. Okay, so after like this kind of like imaging, so we should have a system. This is more important, so because we need to capture the rays coming out from the patient's body. Okay, so there are like 3 methods to like capture the images. So first one is gamma camera, and second one is the single photon emission, and another one is like positron emission tomography. So notice actually during this coronavirus actually in China actually like first time they used X-rays, that is like this method actually, like the PET method, to detect what is the condition of the lung actually, how much like infections in the lungs. So I will show you the picture actually, like how the PET imaging system works, and also how the images and like it's getting captured. Okay. There are like conventional nuclear medicine techniques for infection imaging. Okay, these are some of the radiopharmaceuticals. There is because like that first I have shown you, this is like radionuclides. Okay, this we call radionuclides. When the radionuclides is attached to any chemical compound, it's called radiopharmaceuticals. Okay, and yeah, so you can say like, GA67 citrate, MTC 99 or 111IN level leukocytes, and MTC 99 labeled with granulocyte antibodies, and labeled chemostatic peptides, and 99 MTC or 111IN labeled with human immunoglobulin, and 99 MTC again with like nanocolloids, and the very labeled liposomes, cytokines, streptavidin, biotin, and 18F fluorodeoxyglucose. Okay, so these are the like very conventional, like very commonly used radiopharmaceuticals for like detecting any kind of diseases at early stages. Okay, so targeting nuclear medicine techniques in microorganism imaging. Okay, so this is very important because most of the infection, we are talking about the infection, right? So infection caused by the microorganisms. So it is a theoretical advantage of using an we know that antimicrobial agent. Okay, so that is going to help us to localize the place where the infection has occurred. Okay, and also like so we can give the drugs actually based upon the the quantity of the microbes. Okay, present there. Okay, for example, if you have like very the infection, if we detected the infection in the early stage. So the gram actually, for example, the quantity, for sometimes they give like 100 mg of any kind of antibiotic. Sometimes when the infection is more, then probably they will be giving like 500 mg of like the antibiotic. Okay, so it depends upon like the stage of or like condition of the patient as well as the infection. I mean like for the quantity. I mean like the quantity of the infection. Such agents should like therefore able to distinguish between the I mean this is more important actually. So we should know whether the person has inflammation or infection. Okay, sometimes with the micropathogens and infection due to some immune activity. Okay, so this we need to like differentiate, because sometimes we don't know actually whether the person has like inflammation. So if you know the inflammation, probably it may due to some immunoactivity, because that is autoimmune disease where microbes are not involved. As we know, like because mostly autoimmune diseases are like based because of like immune system. So how our immune system like acts. and it's not like it happened because of the microbes. Okay, there's now a wide range of like radiolabeled antimicrobial agents that are like undergoing evaluation, and the first group of consists of radiolabeled antibiotics such as as I mentioned, this one 99 MTC or 18F ciprofloxacin. Okay, this is a very mostly used antibiotic. Okay, antimicrobial agent. Okay, along with the radionuclides. And 19 MTC sparfloxacin and 19 MTC ceftriaxone, and antifungal agents such as 99 MTC fluconazole and 19 MTC isoniazid, and the antimicrobial tuberculosis agent 99 MTC ethambutol. So there are other secondary group of pharmaceuticals, radiopharmaceutical, okay, so which is derived from the human antibiotic peptides or can be like from proteins, where it binds to the specific bacterial agents, antigens. That is, the peptides derived from human lactoferrin, ubiquitin, and ubiquitin, and human neutrophilic peptide 1, 2, 3. So these are some of the second group of radiopharmaceuticals which attach to some peptides, whereas here it attached to antibiotics, okay, antimicrobials, and second group attached with some antimicrobial peptides or proteins, can be cytokines or kind of things. I will show you in my next slides. Okay, so here you see use of some of the radiopharmaceutical along with the radiopharmaceuticals used. For example, this one is like for 99 MTC ciprofloxacin infection. So this was the first actually done work she published, and where the known or suspected sites of infection 56, and number of patients of 56, and the sensitivity rate was like 84, and specificity was like 96%. And some suspected bacterial infection, for example, this one, because they don't actually which bacteria it is. Okay, so they used around 879 patients in 8 different countries. Okay, under the International Atomic Energy Agency's control, and they used the sensitivity rate was like 85.4, and whereas the specificity was 81.7. So these are some of the other infections and used with this 9-MTC ciprofloxacin to find out the inflammation or infection present. Some of the antibiotics, okay, which attach to the radionuclide TC99M. So you can see the ceftriaxone and fluconazole, isoniazid, and enrofloxacin, vancomycin, pefloxacin, ethambutol, kanamycin, cephalosporin, lomfloxacin, and ofloxacin, sparofloxacin, cefuroxylaxyl, linezolid. Okay, these are some of the antibiotics which are attached to 99 MTC. Okay, so these are some of the list of microorganisms which for which these pharmaceuticals is used to detect. So you can see the ceftriaxone will attach with the radionuclide TC99M to detect E. coli infection, and fluconazole, that is an antifungal, as you know, and attached with again the TC99M to identify or detect actually Candida albicans and also Aspergillus fumigatus. Similarly, isoniazid for anti-tuberculosis attached to TC99M to detect Mycobacterium tuberculosis. Similarly, there are other bacterial infections. Okay. Again, so this is another list of antibiotics used along with TC99M. Okay, so what are the when we say about treatment, actually what happens? Obviously there will be side effects, right? So any kind of drug, when we given its body, actually, there will be any kind of some kind of changes will happen inside our body. So but whereas the nuclear medicine is considered, okay, so there's international guidelines that should be strictly followed if somebody practices the nuclear medicine. Okay, so it is assumed that even the smallest radiation dose poses a risk to patient. Yeah, so even a small dose, obviously there will be risk actually. Okay, so what they made, therefore, a general rule that the amount of exposure during a nuclear medicine procedure is kept as low as reasonably practicable. Okay, that is an alert. So that the quantity of the radionuclide used for the nuclear medicine actually it should be like reduced as low as like reasonably to like to patient to like examine the infection rate. Okay, meaning that the smallest dose of radiation possible is used that will like achieve accurate results exactly. And radio tracers are like designed to act naturally and in conjunction with the body, minimizing the possibility of side effects. And yeah, so nuclear medicine is very safe, and patients do not experience side effects like such as like when you're taking any other like strong antibiotics or like antimicrobials. You used to get like fatigue, dizziness, nausea, or headache. Even like if you go for like any kind of imaging as well, like so you feel when they use it, I mean like long time like exposure to the rays, also the patient will have kind of like issues in their body. Whereas like this nuclear medicine has no issues actually. It will not give any kind of like fatigue, dizziness, nausea, or headache. And also when you're taking the nuclear medicine treatment, the patient can leave the hospital in only one day, or can, and also they can like do their normal activities immediately. So they need not like wait for getting a record, because this is it's a simple procedure to like do that. And radiation from the isotope typically leaves the body through normal excretion within one day. So, like we know actually there's absorption, digestion, metabolism, and excretion in the drug digestive pathway. So what happens when you like take the drug? Actually, it should be like absorbed in your body, and it should be like properly digested, and it should be properly metabolized, and it should be properly excreted. When it get excreted, then only based upon that only the admin properties only we can say the drug is efficient or not. Okay. Similarly, when we use this nuclear medicine, that is radioactive isotopes, what happened that the isotope like leaves the body actually normally within one day. So you don't it won't leave any kind of like metabolites in our body. Okay, so this is about like nuclear medicine. If you have any questions, you are feel free to like ask me here. Also, like you can write email to me, and I have given my phone number. So like if you have any queries, like you can ask me. Any questions?
Thank you so much, sir, for your nice presentation. And I guess we all have a good insight about various type of nuclear medicine, what you have been explained there. And I have a question with you.
Yes,
So
sir.
it's actually maybe that could be related to your topic, or it's a generalized question.
All right.
What is the status of drug for this coronavirus, sir? So is it in the testing? Because still many countries have not officially announced.
Yeah.
So can I just know what is the status from your perspective? Because you might be having a lot of knowledge on this. So that is what, sir.
Yeah. Okay. The coronavirus actually, like when it was like emerged in the year 2002, it's called SARS. Okay.
Yeah.
And now we are having SARS 2, which is SARS coronavirus 2. Even for the SARS, we don't have any kind of like vaccination, because for this kind of like infection, it is very difficult to develop a drug, because drug development process, so it takes like long years. Even like as I mentioned, like the AstraZeneca Pharmaceuticals, like at Bangalore. So still they are like striving to like find out a drug which can cure the tuberculosis in like in a week time of like treatment. Whereas like the virus is considered actually like only the solution is like to find out a vaccine. That is the vaccine which can like given universally, because that is also again going to take much time, because developing vaccine also not that easy. So it normally, even for SARS also, when it emerged in 2002, still now actually we don't have any vaccine for it, even like no drugs for that. Similarly, like after like 2007, there was MERS actually. Even for MERS also, we don't have any kind of like vaccine or like any kind of like drugs for it. So the only solution we have is we need to find out a good vaccine actually. But every vaccine is on the pipeline. For example, China already like they gone to clinical trials level 2, and Russia also they said they already made some drugs, but I mean like vaccine actually, but we don't have any kind of proper information about that. And I mean like again like the Oxford University with our Serum Institute India. So they also trying to come with some vaccine which can be like go for like clinical trials in India, and also the Bharat Biotech actually they also trying to make a vaccine for like SARS coronavirus, but still actually we don't know any kind of like any information about whether that Covaxin actually they call Covaxin. So when it's going to come to market, we don't know because still it's under the pipeline it seems, and they found out like 7 places for conducting clinical trials. For especially for Tamil Nadu SRM Institute actually, SRM Hospital actually, they are going to take the clinical trials, and when other places actually because some other institution they are like given consent to like do the clinical trials at their places. For example, for Tamil Nadu SRM, and some other places, some other institutes would have taken the responsibility of like doing the clinical trials. The problem in the vaccine development is, it's not that easy because we need to know actually how that live attenuated actually or attenuated or like so what kind of like vaccine should be developed. That is more important, and especially for like coronavirus, we need to go for attenuated or like live attenuated based upon like the country. For example, countries like India actually we need to know about the weather condition, also the patient's conditions. So that's a problem. Like when we go for like universal kind of vaccine, probably that is going to help everybody to like get cured. But mostly the vaccine is like now every country is developing based upon the clinical trials based done in their country, in their region with their own citizen. Because we don't have any kind of for example, if you go USA or Europe. You can see the weather system is totally different and the food habits also different. But in India, actually, we do have like we do have only 3. We also have 3 weather system that is hot, hotter, hottest. Okay, so we are having that kind of climate actually weather system in India. So when we have this kind of weather system, then we need to go the vaccine according to our people body condition. So it will take some more time because investing on vaccine development is like very very expensive. Even the Serum Laboratory actually they plan to bring actually clinical trials along with the Oxford University vaccine, but when even actually when they found a vaccine actually it's going to be very difficult for all the patients to be like vaccinated because it's going to be very very expensive. So I'm not sure like when we are going to have a proper vaccine for this SARS coronavirus too.
So we all expect that at least a vaccine has to come as early as possible because due to this pandemic across worldwide, all of them are expecting. It's not only a few, everybody in the world are expecting. But anyway, hopefully everything should be online and we also should get vaccine as early as possible. And yes, participants, do you have any other questions? I think one person have raised his hand, Manish. I'll just allow you to talk. Yes, Manish, you have been allowed to talk. If you want to ask some questions, you can.
Yes, sir, I can hear you.
Yeah, please ask, Manish.
Sir, good evening, sir. Sir, since we are talking about the drugs and vaccines in this topic, I had a general question, sir.
Yes.
If you have in case of coronavirus, in coronavirus or in case of cancer, we have that drawbacks of finding a particular vaccine to cure that disease or virus which are in our body. So in case of HIV or AIDS, I want to know what is the barrier to find a vaccine for that, for AIDS or HIV?
Yeah, for HIV, the reason is the HIV is a retrovirus. Okay, so what happens? The virus actually it changes its genetic the RNA. Okay, the RNA it easily changes. So that is the problem of finding drug for that HIV. You got my answer? HIV is a retrovirus, okay, and the RNA is actually get reverse. Actually, when you give any kind of drug, it automatically changes in the gene. So that's the reason actually we don't have any kind of drug so far for HIV.
Yes, sir. I guess Manish, your question has been answered.
Yes, sir. Yes, sir. Yes, sir. Thank you so much.
Okay,
thank you so much.
Thank you. So, any other participants willing to ask questions? You can raise your hand. I will allow you to talk, or you can put your questions in chat box. We'll have a discussion. Any questions from the participant side? Sir, I have another question.
Yes, sir.
Maybe I don't know this is perfect to this topic or not. Just a general question.
Yes, sir.
So, is there any cure in Ayurveda or Siddha medicine when compared to allopathy for
Yeah.
this, especially COVID? And what is the barrier lies behind this allopathy techniques and your Ayurveda and Siddha? If not, it is appropriate to the topic at least.
No,
We
no,
have-
like because I gave a talk for VAT
Yeah.
of the traditional Chinese medicine actually. So I have the answer for your question.
Yeah.
Actually, in India actually we do have like different kind of treatment practice. For example, we only give allopathic drugs, for example, okay. But whereas in China actually they give allopathic also with the traditional Chinese medicine, because what happens actually every drug has its role, right? So what happens, the traditional Chinese medicine, when they add different kind of like components actually that how to say, herbs, okay, I could say different kind of herbs, when they include, every herb has a different kind of role. For example, some herbs will remove the toxicity of the drug which has been administered. And second thing, sometimes the herb will like boost the immune system, and sometimes that herb can keep the drug for a long time until that the infection get cured. So this is how in China actually they practice. Whereas in India actually we don't have that kind of system. So what will happen actually, we don't have a proper record of anything, and we didn't go for any kind of like clinical trials. We didn't have proven so far. That's a drawback in India. But we do have like very good quality of herbs actually. And we actually India is full of Ayurvedic herbs. Actually, it's present everywhere. Actually, even any kind of like local places you can find something actually which has some herbs actually which can cure some kind of diseases. But the problem, we don't have any proper formulation. First thing, in India we don't have any proper formulation of any kind of this kind of thing. And even the Kabasura Kudini actually they given actually for the immune booster. Yeah, so they given it for immune, because it's going to be supportive, even though they give allopathic drugs. But this kind of like Kabasura Kudini can stabilize your body actually, can immunize your body, and also it will help the drug actually, the allopathic drug to work in an efficient way. This is how even the traditional Chinese medicines also they are following. They are using various kind of like herbs, and with the herbs actually they're making any one, for example, for if you have any stomach problem, we used to have even like when you go to doctor, when they're prescribing any kind of like an antibiotic, strong antibiotic, they used to give that Rantac, right? Rantac, or sometimes they give Omaze. Okay, so again, that is going to create some side effect for you. Okay, but in Chinese traditional Chinese medicine, what they do, they don't give any kind of this kind of things. For that, they give alternative, that is the herb, okay, which can keep the stomach pH in a normal way. So the drug can work efficiently. So our body can metabolize the drug very efficiently, also do the excretion properly. So that's how the practice should be done. But in India, actually, we are not combining together. So we only go for either Ayurvedic, or we only go for Siddha, or we only go for allopathic. That's a problem. When we combine together, when we formulate and when we treat efficiently, probably that is going to be very good actually. We might have a good drugs actually for many kind of disease. Even for HIV also, we could say actually we could develop some drugs. Even you don't notice many of the times the newspapers and all, they used to say actually somewhere actually some person is treated with HIV infection. Okay. So why I'm saying, because we don't have any proper record or proper formulation, and also we don't have any kind of clinical trial or something they had done. So this is kind of like orally they say, okay, I have been there, they given some medicine, but it won't work with everyone. The problem is we don't have any proper formulation. When we have proper formulation, we know how much quantity, how much grams of this compound should be added, and how the drug should be developed. But we don't have any kind of practice. So they just give actually as a powder form or something which has no formulation information. Whereas the allopathy, you can see how much, because mostly nowadays the drugs are coming with the combination chemistry. They come in two different chemical compounds and they develop the drugs. Okay. They mentioned how much milligram or nanogram of any compound they added. They mention it. But whereas in the Ayurvedic, they mention, but they don't give the exact the formulation of the products, how they made it, because there's no certification actually of that kind of products. So that's a problem in India.
Yes, sir. Thank you. Thank you so much, sir, for your question and answer session. I think again Manish have raised his hand. You're something to talk, Manish?
Yes, sir.
Yeah, please.
Sir, in case of coronavirus, we heard that doctors are treating the patient with the plasma of the recovered patients, no, sir?
Yes, yes.
How
Oh,
was
yeah.
that technique is effective, sir?
No,
Is
it's
that
not effective. It's not effective, actually, like I could say. Actually, when actually they done the plasma therapy in South Korea, even those patients who recovered, actually, from the recovered person only, actually, they took the plasma, right? Even the recovered person again got infection. He got
yes,
it.
sir? That's what the main thing that I'm
Yeah.
asking.
Yeah. So again, the person who got recovered also get infected with the virus. So the plasma therapy is not efficient. But anyhow, but in India, actually, they're calling volunteers donate their blood for using the plasma for treating. But how actually it's not recommended because already it has been made issues in South Korea. So we have lessons actually from the past. So I don't think it's a good idea to do the plasma therapy.
Sir, and one more thing, sir. So in case of something very, very cruel disease or something like that, if it is coming, we hear that they will be treated with stem cells. So is there
Yes.
any test been taken regarding COVID-19 or something like that, sir?
Yeah, stem cells can be actually but not this kind of infection. These are some of the emerging infections. For example, if any kind of diseases, okay, infection is different and disease is different. Okay, so when you have an infection, so it's very difficult to use it stem cells to do. For example, you have some liver problem. Okay, liver some serious liver cirrhosis. Okay, something if you're having. Then that time, what you can do actually, if your stem cell actually, for example, the umbilical cord blood, okay, when the umbilical cord blood is stored, from that actually we can for example yours or your brothers, okay, someone like your siblings, okay, even if it's not your umbilical cord blood was not stored actually, it can be used any of the siblings their blood is stored, okay. So using that actually we can do the liver transplantation kind of things can be done, but this kind of infections there is no possibility of using stem cell because that infection won't be having the kind of record of all those things. Whereas diseases, there are possibilities of getting record by using the stem cells method. And life cells India actually, in India actually life cell India actually they are having the cord blood bank actually. So if you can you can tell them they will store it for long years. Whenever you want actually you can go and get the blood and you can go for stem cells therapy you can do it.
Yes, sir. Thank you. Thank you so much for your answer. So is there any other questions from participant side?
So I have a question, sir.
Yes, madam, please.
Sir, I've just come across this nitric acid and nitric oxide, sir. They're telling that it has killed the SARS virus in cell culture test, and it is also improving the blood oxygen level. Is that the main chemical which is being used in the vaccine, or is that effective?
Sorry, I don't have information about that. Probably actually, maybe because that some components actually, which is going to help us to improve the virus. Sometimes they don't give it live, so they give attenuated live attenuated sometimes. So probably the nitrous oxide maybe improve the vaccine, to stay in our body for long years, because that's how when we got that we give a DPT, diphtheria, pertussis, tetanus vaccination, and also we have another one, PCG vaccine. Okay, so probably that when you're adding that nitrous oxide, actually probably that is going to keep the virus, live attenuated virus, when we, so it can remain in our body for long years. So our body can memorize of that infection when it comes. So automatically our body start fighting against that disease. Probably that can be a reason, but I'm not sure whether the exact information of using that actually. I'm also discussing with you. Probably that is the reason actually they are adding it.
Yes, sir. Thank you. Is there any other questions from participant side? Yes, if you want to ask question, you can unmute yourself or raise your hand. I can allow you to talk, or you can put your question in chat box. Okay, so if everything is done, I think we can wind off the session. Um, yes, I guess no more questions from the participants, right? Yes, ma'am. We can formally wind off, madam.
Okay. Okay, sir. As an end comment, I would like to sincerely thank our management for permitting us to conduct this international webinar series. I would like to thank our today's speaker, Dr. Ramasamy Rajesh Kumar, for sharing the valuable insights about nuclear medicine and its applications. I would like to thank our HOD for his graceful support extended towards this webinar session. And I would like to thank our fellow faculty members for their wonderful coordination. And finally, I would like to wholeheartedly thank all the participants from different locations for your presence and making this webinar a grand success. Once again, thank you all. Thank you.
Thank you so much, sir, for your valuable presentation on this nuclear medicine. And I hope we all got a good insight about this one. And also we have discussed on various domains and topics. And thank you for your valuable answers, sir. So thank you from our end.
Thank you very much for listening my presentation patiently, and thank you very much for giving me the opportunity to AVIT and also Dr. Prabhakaran and also Lakshmi Sri and someone else. Actually, she called me. I forgot her name. Actually, I thank everyone for joining today's meeting, and have a good evening.
Thank you, sir. Thank you so much. Yes, ma'am. We can formally wind up.